Hello and welcome to this British Psychological Society audio interview. I'm Wendy Barnaby and I'm joined by Daniel Freeman, Professor of Clinical Psychology at the University of Oxford and a BPS Fellow. Dan, we're here to talk about your research into gender and mental illness. How important a factor is gender in mental illness?
I think it's a fantastic question and one that's been completely neglected. Almost half of ill health in adults is mental ill health. And I think the answer is yes, one gender does suffer more in the current environment, and that gender is the female gender.
Just to be clear, are we talking about the UK, the world, the developed world? What are we talking about exactly?
Well, it's a very hard thing to determine in terms of the burden of mental health problems. What we did was look at national epidemiological studies. So we looked at representative groups of the general population to assess rates of mental health problems. These sorts of studies are large and expensive and therefore rare. They tend to be in Europe, Australasia and North America. So it's those countries only that we really know about in terms of this issue.
And what specific disorders, illnesses are we talking about?
Well, there's a pattern within this. So what we find is that for many common mental health problems such as depression, insomnia, panic disorder, post-traumatic stress disorder, sexual problems, eating disorders, women's rates are higher than men. But it's not a one-way street. Some problems are approximately equal in both genders, for example, psychosis, and men suffer more alcohol and drug problems than women. So sometimes we talk about women have more internalizing problems, taking them out on themselves, and men have more externalizing problems, taking out problems via the environment. However, the analysis that we've done, the new analysis, the only time it's ever been done really, shows that this balance between internalizing and externalizing disorders isn't equal, that actually the balance is tilted, the burden is more on women.
So women tend to internalise things more than men who act them out more, is that it?
That's a summary. Of course, these problems affect men and women, many millions of them. So to describe mental health problems as predominantly female problem is wildly inaccurate. However, perhaps 20 to 40% of the burden is greater on women. In fact, the best study ever was conducted, the most comprehensive study was in Germany, and that showed rates of mental health problems were about, in the current year, 25% of men were suffering. So that's a huge number. So it's a significant problem. And many of them are having anxiety and depression, absolutely. But the rates in women were 37%, so that's 50% higher. So it's extraordinary, really. So if you translate even a sort of 20 or 40% difference in such a common problem, then you're talking potentially about a major public health issue, I think.
How do you explain it?
I think that's an incredibly important question. Research on gender differences, overall rates of mental health problems are incredibly rare. So this was the first study that we did actually looking at the national data sets, and that was simply asking, is there a problem to be explained? Why there is a gender difference is extraordinarily important. I think it's complicated, but if I have to go for one factor, I think it's the social environment. Partly we know it's because the most common problems that differ the most between the genders, we know the contribution in the environment is most important. So I think it's probably in the social pressures on the women to be carers, homemakers, often breadwinners, but importantly, all while having less reward and control over the experiences and the pressures to look good whilst doing it. I think it's these pressures that have such an impact on people's self-esteem, their self-worth, that makes women potentially more vulnerable to mental health problems in the current environment.
I was really struck by something you wrote, which is that as men put on weight, they earn more, and as women put on weight, they earn less.
I mean, it's extraordinary, isn't it? And I think there are other examples, we see sometimes in the gendered toys that we see where, science is for boys and, pink castles are for women. I mean, I think it's extraordinary, some of these gender biases that sometimes are quite explicit like those, but also perhaps sometimes more subtle and implicit.
What relevance do you think your research has for practical action against mental illness?
What I want to stress is I think we need more research to definitively show that the rates are different between the genders. The work that I've done has had to sort of put together data from national data sets and look at the ways they weren't necessarily first designed to do. Interestingly, many of the national data sets don't cover some very common problems like sleep problems and sexual problems that we know are much more common in women than men, but they're not even assessed in these surveys. So if we can do much more comprehensive surveys, we'll learn more. And then I think we do need to learn more about the actual research reasons, the explanations for these differences before necessarily react. Although, of course, most of the research is pointing to this is another argument for the need to reduce inequality in society. But I think one of the striking things about this, perhaps, is that I'm talking about gender and mental health issues. I've done this research, but that's actually not what I do in my day-to-day job as a clinical psychologist. I research psychosis, and that's where I do my work. But there isn't such stark gender differences. I came into this research inadvertently, so it's not what I do. I did this almost in my spare time, going away researching this, because I sort of was fascinated by the idea that there may be a difference in the cause. But I think we need many more people doing this kind of research.
So we need many more people doing it to establish the facts, and then perhaps try to tackle it, would you think, trying to reduce inequality, so trying to stop the incidence rather than have a different sort of treatment?
Yes, I think this is where that research is particularly pointing. However, these problems are not innate or inevitable. Gender, it isn't just an innate part of a gender. It's not that. It's about the pressures on the societal pressures, and we can use gender a way as perhaps identifying the particularly pernicious elements of the environment. So in fact, we could learn more as well about the causes, and that could impact on therapy later. We need to pay far more attention to gender and mental health issues. There are many books now on differences between the genders. You can think sort of men are from Mars, women are from Venus. There are many books discussing these sorts of sort of cognitive or social differences between men and women. However, conspicuous, I think, by its absence is any discussion of mental health problems. Mental health problems matter. So we should be seeing whether our environment is having greater adverse effects on one gender than another. So I think we need to pay a lot more attention.
Thank you very much, Dan.